Hey everyone, welcome back to my YouTube channel. Today we are going to talk about sensory innervation of face, and this is at the side is the diagrammatic or schematic diagram of sensory innervation of face. You need to consider it when we will talk about sensory innervation of face. So we will start our topic with introduction. Sensory nerve supply of face is primarily provided by trigeminal nerve, that is cranial nerve number 5, which is responsible for detecting touch, pain, temperature, and proprioception. Additionally, contribution from cervical spinal nerve also help provide sensation to regions like jawline and neck. Here you can see in diagram, the orange color region is supplied by cervical spinal nerves. Sensory fiber or trigeminal nerves are distributed across the face through its three major divisions. The ophthalmic division is in this diagram is green in color, the maxillary division that is blue in color in this diagram, and mandibular division that is yellow in color in this diagram. So you need to know what area is supplied by which branch of the trigeminal nerve. And here is the diagrammatic or schematic representation of trigeminal nerve distribution for the facial nerve supply, sensory nerve supply of face more specifically. Now further talking about sensory innervation, it is by ophthalmic nerve, that is upper facial sensation, maxillary nerve, that is mid face sensation, and mandibular nerve, that is lower facial sensation, and these three are the branches of trigeminal nerve. In addition to this, there is also cervical nerve contribution, that is by C2 and C3. We will start with the ophthalmic nerve, that is the first branch of trigeminal nerve that supplies the upper facial sensation. That is, the ophthalmic nerve provides sensory input from the forehead, upper eyelid, dorsum of eye, and anterior scalp. As you can see in the diagram here, the green color area is supplied by ophthalmic nerve, that is branch of trigeminal nerve. The division has three key branches of nerve supply, that are supratrochlear nerve that innervates the medial forehead and upper eyelid and supply at that place. Then it has supraorbital nerve that supplies the forehead, frontal scalp, and upper eyelid. And the third branch is infratrochlear nerve that provides sensation to the medial canthus, nasal root, and lacrimal sac. Then it also has external nasal branch of anterior ethmoidal nerve that innervates the skin of the dorsum of the nose, and the lacrimal nerve that supplies the lateral upper eyelid and lacrimal gland. And this nerve division ensures fine sensory perception in the upper face, playing a role in detecting temperature and light touch stimuli. Further we have is maxillary nerve, that is second branch of trigeminal nerve and that supplies sensation to the mid face. The maxillary nerve carries sensory information from the lower eyelid, cheeks, upper lips, upper teeth, and lateral nose. It has several branches that include zygomatico-temporal nerve that provides sensation to the temporal region, zygomatico-facial nerve that supplies sensation to the cheekbone and upper cheek area, and it also has infraorbital nerve that innervates the lower eyelid, upper lip, and lateral nose. It has superior alveolar nerve that may be anterior superior alveolar nerve, middle superior alveolar nerve, and posterior superior alveolar nerve, and it supplies the upper teeth and surrounding gingiva. It also has palatine and nasal branches that innervates the hard palate, nasal mucosa, and upper jaw. And this division ensures pain, touch, and pressure sensitivity in the mid-face, particularly around the cheeks and nasal cavity. Next branch of trigeminal nerve that supplies the face or that supplies sensory nerve supply of the face is the mandibular nerve, that is branch of trigeminal nerve, and it supplies the lower facial sensation. The mandibular nerve that provides sensory supply to the lower lip, chin, jaw, lower teeth, and temporal region. It contains the following branches that are auriculotemporal nerve that supplies the temple, tragus and lateral scalp. The second branch of it is buccal nerve that provides sensation to the cheek mucosa and external cheek skin. Then it has mental nerve that innervates the lower lip, chin, and anterior mandibular skin. It has inferior alveolar nerve that carries sensation for the lower teeth and gums. And this division is vital for detecting pain and touch sensitivity in the lower face and jaw, ensuring proper oral and facial sensation. Next, in sensory innervation, we have cervical nerve contribution, that is by C2 and C3. While most facial sensation is governed by trigeminal nerve, region of the lower face and neck receive sensory input from cervical spinal nerves. and these include greater occipital nerve that provides sensory supply to the posterior scalp. Lesser occipital nerve, that is also the branch of C2, it innervates the lateral head and upper neck. Then greater auricular nerve, that supplies the lower cheek, ear lobes, and jawline. And these cervical contributions help extend sensory coverage to areas beyond trigeminal nerve distribution, such as the posterior scalp and lower jaw. Now let's talk about clinical significance of sensory nerve supply of face. Understanding facial nerve supply is crucial for diagnosing neurological conditions, nerve injuries, and pain syndrome. Some common disorders include trigeminal neuralgia, that is severe facial pain due to irritation and compression of cranial nerve number 5 branches. Any of the branch may be affected. The second clinical significance is facial numbness that can result from trigeminal nerve damage, infection, or trauma. As the trigeminal nerve is the main supply of the facial sensory supply, so in case of damage, it can cause facial numbness. There may be maxillary or mandibular fracture that may lead to sensory deficits in corresponding nerve regions. There may be cervical radiculopathy, that is compression of cervical nerve causing altered sensation in lower facial area that is supplied by cervical nerves. And proper neurological assessment of facial nerve function helps in managing disorders affecting sensory perceptions. And this was all about the sensory nerve supply of face. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.